Question 1. A home care nurse visits a patient 2 days post-cataract extraction and implant. Which of the following statements made by the patient indicates a need for additional teaching? A. I understand I can't shampoo my hair for a week. B. I realize my husband will need to lift anything over 5 pounds for the next week. C. I will contact the doctor if I start to feel nauseous. D. My eye is a bit itchy, which I believe means it is healing. Correct answer, A. I understand I can't shampoo my hair for a week. After cataract surgery, patients are usually advised to avoid getting their eye wet for a certain period. But this does not typically extend to shampooing the hair. Instead, they should be instructed to avoid getting water in the eye, and may need to protect the eye with a shield while sleeping or showering. Shampooing the hair can usually be resumed after a few days, as long as the patient takes care to avoid water directly contacting the eye. Question 2. Which of the following actions by a patient performing peritoneal dialysis at home would be considered incorrect? A. The patient is not concerned when the outflow is slightly tinged green. B. The patient is not concerned when the outflow is slightly tinged red. C. The patient rocks back and forth to assist outflow. D. The patient wears a mask when connecting and disconnecting the catheter. Correct answer. B. The patient is not concerned when the outflow is slightly tinged red. Red-tinged outflow can indicate bleeding from the peritoneal cavity, which may be due to trauma, irritation, or more serious complications such as peritonitis or catheter complications. A slightly tinged red outflow could be normal immediately after the catheter is inserted, but ongoing or significant blood in the dialysate should be promptly evaluated by a healthcare provider. Question 3. Which statement made by a patient recovering from cataract surgery requires clarification from the nurse? A. I will use my Vicine eye drops as needed. B. I know I may need glasses for a while after this surgery. C. I know it's normal for my eyes to feel irritated or itchy after surgery. D. My eye should be completely healed after about 8 weeks. Correct answer, A. I will use my Vicine eye drops as needed. After cataract surgery, patients are usually prescribed specific prescription eye drops, such as antibiotic and anti-inflammatory drops, to help prevent infection and reduce inflammation. Vicine is an over-the-counter eye drop often used to relieve redness or irritation, but it is not recommended after cataract surgery because it could cause dryness or irritation, or even interfere with the healing process. Patients should avoid using non-prescription drops like Vicine unless instructed by their healthcare provider. Question 4. Which intervention should be included in the care plan for a patient with pheochromocytoma? A. The patient will avoid ingesting any caffeine. B. The patient will observe a limited-calorie meal plan to maintain weight. C. The patient will receive a moderate amount of daily exercise. D. The patient will receive social stimulation with at least 4 hours spent in the day room daily. Correct answer, A. The patient will avoid ingesting any caffeine. Pheochromocytoma is a rare tumor of the adrenal glands that produces excessive amounts of catecholamines, epinephrine and norepinephrine. These hormones can cause hypertension, tachycardia, headaches, and other symptoms. Caffeine is a stimulant that can increase catecholamine levels, which can worsen the symptoms of pheochromocytoma. Therefore, it is important for patients with this condition to avoid caffeine to prevent exacerbating their symptoms. Question 5. Which patient is most likely to exhibit a green stick fracture? A 28-year-old male who fell off his bike while in a triathlon. B, a 50-year-old male who fell off a ladder while fixing his roof. C, a 72-year-old female who fell while in the shower. D, an 8-year-old male who fell off a trampoline. Correct answer? D, an 8-year-old male who fell off a trampoline. A green stick fracture occurs when a bone bends and cracks on one side, but doesn't break all the way through, similar to bending a green twig. This type of fracture is more common in children because their bones are softer and more flexible. Question 6. Which actions should the LPN take before ambulating a client who has undergone a total knee replacement? A. Instruct the patient to march in place for 30 seconds. B. Ask the patient to raise their arms above their head. C. Help the patient move to a sitting position at the edge of the bed. D. Inquire about the patient's most recent fall. Correct answer? C. Help the patient move to a sitting position at the edge of the bed. The appropriate action is to assist the client to a sitting position at the edge of the bed before ambulating. This action is important because it helps prevent orthostatic hypotension, a common issue after surgery where blood pressure can drop upon standing, leading to dizziness or fainting. Sitting at the edge of the bed allows the client to adjust to an upright position gradually, reducing the risk of falls or injury during ambulation. Question 7. Which finding should be of the least concern for an LPN caring for a primarily bedridden client? A. Swollen feet. B. Capillary refill of 3 seconds on the big toe. C. Leg pain. D. Brown discoloration above the ankles. Correct answer? B. Capillary refill of 3 seconds on the big toe. A capillary refill time of less than 3 seconds is generally considered normal and indicates adequate peripheral circulation, while a capillary refill time of exactly 3 seconds is borderline. It is still within the acceptable range for most individuals, especially in a bedridden client. Question 8. Which food on the tray would be the best to start with when assisting a client with dysphagia at lunch? A. Toast. B. Jell-O. C. Apple juice with a liquid thickener. D. Diced fruit. Correct answer. B. Jell-O. Jell-O is the best option for a client with dysphagia because it is soft, smooth, and requires minimal effort to swallow, making it less likely to cause choking or aspiration. It's also easy to control the consistency to match the client's swallowing abilities. Question 9. The LPN is receiving the report on a comatose client at the start of the shift at 1500. What statement should be of most concern? A. The client's PEG tube was changed 6 months ago. B. The client's indwelling urinary catheter was last changed 5 days ago. C. The client was repositioned on his right side at 1100. D. The client was bathed and skin was assessed, head to toe, at 0900 with no abnormal findings. Correct answer. B. The client's indwelling urinary catheter was last changed 5 days ago. Indwelling urinary catheters should be changed regularly, typically every 2 to 4 weeks depending on hospital policy or the patient's condition, to reduce the risk of infection, blockage, or other complications. A catheter that has been in place for 5 days without being changed could be a potential source of infection, especially in a comatose patient who may not be able to communicate discomfort or signs of infection effectively. Question 10. The LPN is observing a patient using crutches for a leg injury. Which of the following indicates the need for further education? A. The patient positions the top padding 1 to 2 inches below the armpit and holds the handles firmly. B. The patient rests the armpit on the top padding and loosely grips the handles. C. When descending stairs, the patient leads with the injured leg. D. The patient maintains a slight bend in the elbow while holding the handles. Correct answer. B. The patient rests the armpit on the top padding and loosely grips the handles. When using crutches, the client should avoid resting their weight on the axilla, armpits, as this can lead to nerve damage, axillary nerve palsy, and discomfort. Instead, the client should bear weight through their hands by firmly gripping the handles. The crutches should be positioned approximately 1–2 inches below the armpits, and the elbows should be slightly bent to allow for proper support and movement. Question 11. Which statement from the caregiver of a palliative care client demonstrates a proper understanding? A. The primary goals of treatment are comfort and improving quality of life. B. We will have to stay in the hospital to receive this level of care. C. This treatment plan typically indicates a prognosis of less than 6 months. D. Medications for the underlying disease will be discontinued. Correct answer. A. The primary goals of treatment are comfort and improving quality of life. Palliative care focuses on providing comfort and enhancing the quality of life for patients with serious illnesses, rather than aiming to cure the illness. This involves symptom management, pain relief, emotional support, and helping the patient and family navigate the challenges of serious illness. Question 2. Which of the following does not need to be included when calculating a client's fluid intake? A. IV fluid from an antibiotic piggyback. B. Jello. C. Pudding. D. Ice chips. Correct answer. C. Pudding. Pudding is generally considered a solid or semi-solid food and does not contribute significantly to overall fluid intake, unlike liquids such as water, juice, or soups. When calculating fluid intake, items like oral beverages, IV fluids, and foods that are primarily liquid at room temperature, e.g., ice cream, broth, Jello, are typically counted. Question 13. Which type of fluid output is usually not measured? A. Evaporative water from the respiratory tract. B. Emesis. C. Chest tube drainage. D. Urine. Correct answer. A. Evaporative water from the respiratory tract. Evaporative water from the respiratory tract, also known as insensible water loss, occurs through normal respiration and is not typically measured in clinical settings. Insensible losses also include perspiration from the skin, and these losses are difficult to quantify accurately. Question 14. Which of the following statements made by a client with an NG tube indicates a need for further teaching? A. I should remain sitting up at a 45-degree angle or higher for 30 minutes after a feeding. B. I should avoid using Vaseline around the nostril and C. I can clean around the tube with water and mild soap. D. Since I'm not eating or drinking by mouth, I do not need to brush my teeth as often. Correct answer. D. Since I'm not eating or drinking by mouth, I do not need to brush my teeth as often. Even though the client is not eating or drinking by mouth, regular oral hygiene is still crucial. Clients with NG tubes are at higher risk for dry mouth, bacterial buildup, and oral infections, which can lead to further complications. Proper oral care, including brushing teeth regularly, helps prevent these issues and maintains overall oral health. Question 15. Which of the following steps is incorrect when checking for residual before administering enteral feeding through a PEG tube? A. If the residual is greater than 200 ml, the LPN should not administer the enter-all feeding. B. The LPN elevates the head of the bed at least 30 degrees. C. The residual pH level is tested to ensure appropriate placement. D. The residual should be discarded prior to administering the tube feeding. Correct answer. D. The residual should be discarded prior to administering the tube feeding. In most cases, gastric residuals should be returned to the stomach rather than discarded, unless the residual amount is excessive or otherwise indicated by the healthcare provider. Gastric residuals contain important digestive enzymes and electrolytes that are beneficial for maintaining the client's nutritional and fluid balance. Discarding the residual could lead to electrolyte imbalances and loss of nutrients. Question 16. The LPN is auscultating bowel sounds and hears 3 to 4 sounds per minute. This finding is somewhat expected in which of the following clients? A. A 56-year-old female with dementia undergoing a swallow study. B. A 63-year-old female undergoing chemotherapy for breast cancer. C. A 45-year-old male recovering from a knee replacement under general anesthesia. D. A 34-year-old male with a PEG tube newly admitted for diabetic ketoacidosis. Correct answer. C. A 45-year-old male recovering from a knee replacement under general anesthesia. General anesthesia commonly causes a temporary decrease in gastrointestinal motility, leading to hypoactive bowel sounds, 3 to 4 sounds per minute. This is expected in clients recovering from surgery, as the anesthesia slows down the digestive system. It may take some time for normal bowel function to resume after the effects of anesthesia wear off. Question 17. What is the most appropriate response when a client with an NG tube asks if they can lie down after receiving evening medications through the NG tube? A. Yes, feel free to lie down. Or B. You can lie down in 5 minutes if your NG residual is below 50 ml. C. You can lie down in 1 hour. D. You can lie down in about 30 minutes. Correct answer. D. You can lie down in about 30 minutes. This advice is based on the need to prevent aspiration after administering medications through an NG tube. Keeping the head of the bed elevated at a 30-45 degree angle for at least 30 minutes after administration ensures that the medications and any residual fluid move down into the stomach properly, reducing the risk of reflux or aspiration into the lungs. Lying down too soon after administration could increase the risk of complications, making it important to wait before allowing the client to lie flat. Question 18. Which of the following is least important to assess when evaluating a client's motor skills? A. Knowledge of ergonomics. B. Coordination. C. Balance. D. Strength. Correct answer. A. Knowledge of ergonomics. Motor skills assessments typically focus on the client's strength, coordination, balance, range of motion, and ability to perform specific movements or tasks. Knowledge of ergonomics is more related to understanding body mechanics and how to perform tasks in a way that minimizes strain or injury. While important for preventing injury, it is not a direct measure of the client's physical motor abilities. Question 19. Which of the following is an appropriate step when communicating with a patient who is hard of hearing? A. Ask multiple questions in a row quickly to make sure the client is engaged. B. Divide the verbal communication into smaller sections and address one at a time. C. Communicate only with written information. D. Frequently communicate without assistive devices to help the client improve their hearing. Correct answer. B. Divide the verbal communication into smaller sections and address one at a time. Breaking verbal communication into smaller, manageable sections allows the patient to better process and understand the information being conveyed. This method helps prevent overwhelming the patient with too much information at once and allows for easier lip reading, use of hearing aids, or other assistive devices. Question 20. What is the most effective method for preventing skin breakdown? A. Assistive devices. B. Repositioning. C. Avoiding tape and band-aids. D. Topical medications. Correct answer. B. Repositioning. The most effective way to prevent skin breakdown is repositioning, because it helps alleviate prolonged pressure on specific areas of the body, particularly in immobile or bedridden patients. Continuous pressure reduces blood flow to the skin and underlying tissues, which can lead to pressure ulcers or sores. By repositioning every 2 hours, or as per protocol, blood circulation is improved, oxygen is delivered to tissues, and pressure points are relieved. This practice is crucial in preventing the development of pressure injuries, especially in high-risk areas such as the sacrum, hips, heels, and elbows. Repositioning, combined with proper skin care, hydration, and nutrition, significantly reduces the risk of skin breakdown. Question 21. Which of the following is least important when assessing a client's risk for elimination impairment? A. Family history. B. Ambulation abilities. C. Current medications. D. Hydration status. Correct answer. A. Family history. Elimination issues are typically influenced by factors such as the client's current medications, hydration status, and ambulation abilities, which directly impact bowel and bladder function. Family history may have some relevance in certain conditions, but does not have as direct an effect on immediate elimination impairment compared to the other options. Question 22. What would be an appropriate action for the LPN caring for a 32-year-old female client who is 8 hours post-op following a tonsillectomy? A. Monitor vital signs every 15 minutes. B. Offer ice water with a straw to encourage fluid intake. C. Explain to the patient that ear pain may occur and is a normal part of recovery. D. Provide hot tea to help soothe the throat. Correct answer. C. Explain to the patient that ear pain may occur and is a normal part of recovery. The action of informing the client that ear pain may occur and is normal after a tonsillectomy is appropriate. This is because referred ear pain is a common postoperative symptom following a tonsillectomy. The nerves in the throat and ears are interconnected, and irritation or inflammation from the surgery can cause pain to be felt in the ears, even though the ears themselves are not affected. Educating the client about this possible symptom helps alleviate concern and ensures they understand that it is a normal part of the healing process, rather than a sign of a complication. Proper pain management and reassurance are important aspects of postoperative care after a tonsillectomy. Question 23. Which statement to the client's family would be appropriate when preparing to provide postmortem care? A. I am unable to assist you, but we can contact pastoral care for comfort if needed. B. You won't be able to see your loved one after postmortem care is completed. C. We are unable to follow any cultural practices during the preparations. D. I will make sure your loved one is properly identified before transport. Correct answer, D. I will make sure your loved one is properly identified before transport. The most appropriate response is to ensure that the family feels that their loved one will be treated with respect and dignity. Proper identification before transport is crucial for legal and procedural reasons, and this statement reflects professionalism and reassurance. Question 24. Which class of drugs is most fatal when overdosed? A. Antihistamines. B. Benzodiazepines. C. Tricyclic antidepressants. D. Typical antipsychotics. Correct answer, C. Tricyclic antidepressants. Tricyclic antidepressants, TCAs, are the most fatal when overdosed because they have significant cardiotoxic effects. Overdose of TCAs can lead to severe cardiac arrhythmias, such as torsades de pointe, which can be life-threatening. This is due to the drug's ability to block sodium channels, affecting the electrical conduction of the heart. Question 25. A patient receiving ziprasidone for schizophrenia develops Parkinson-like symptoms. Which medication should the nurse recommend to decrease these side effects? A. Benztropine. B. Bethanacol. C. Levodopa. D. Ropinirole. Correct answer, A. Benztropine. Ziprasidone is an atypical antipsychotic used to treat schizophrenia, but like other antipsychotic medications, it can cause extrapyramidal symptoms, which include Parkinson-like symptoms such as tremors, rigidity, and bradykinesia. Benztropine is an anticholinergic agent commonly used to treat Parkinson-like symptoms caused by antipsychotic medications. It works by blocking the action of acetylcholine in the brain, which helps to restore the balance between dopamine and acetylcholine, and alleviates the symptoms of Parkinsonism induced by antipsychotic drugs. Question 26. A patient has been started on valproic acid for the treatment of bipolar disorder. Which instruction should the nurse provide to the patient? A. Notify the physician if you become pregnant or if you are planning on becoming pregnant. B. Stop taking the medication if you experience headaches. C. Stop taking the medication if you experience weight gain. D. Use a generous amount of sunscreen to avoid photosensitivity. Correct answer, A. Notify the physician if you become pregnant or if you are planning on becoming pregnant. Valproic acid is an anticonvulsant and mood-stabilizing medication commonly used in the treatment of bipolar disorder. However, it has been associated with a significant risk of birth defects if taken during pregnancy, particularly neural tube defects like spina bifida. Due to these risks, it is important for patients to notify their physician if they become pregnant or are planning a pregnancy so that alternative treatment options can be considered. Question 27. A schizophrenic patient is receiving haloperidol. Which of the following extrapyramidal side effects is the patient most likely to develop? A. Pacing. B. Seizures. C. Tics. D. Tremors and shuffling gait. Correct answer. D. Tremors and shuffling gait. Haloperidol, a typical antipsychotic, is most likely to cause Parkinsonism, which includes symptoms like tremors and a shuffling gait. These are common extrapyramidal side effects of this medication. Question 28. A patient is prescribed lorazepam for anxiety. Which of the following possible side effects should the nurse include in the patient's education? A. Barking cough. B. Confusion. C. Diarrhea. D. Increased risk of infections. Correct answer: B. Confusion. Lorazepam, a benzodiazepine, can cause confusion, particularly in older adults or when taken in high doses, due to its sedative and cognitive impairing effects. Question 29. A patient is prescribed amitriptyline for the treatment of depression. Which of the following common side effects should the nurse educate the patient about? A. Diarrhea. B. Excessive tears. C. Hypertension. D. Lethargy. Correct answer: D. Lethargy. Amitriptyline is a tricyclic antidepressant, and it commonly causes several side effects due to its anticholinergic, sedative, and antihistaminic effects. One of the most common side effects is lethargy or drowsiness, especially when starting the medication, as it has sedative properties. Question 30. The nurse is caring for a patient with Alzheimer's disease who is taking donepezil. Which of the following side effects should the nurse assess for related to donepezil? A. Bradycardia. B. Constipation. C. Dry mouth. D. Tachycardia. Correct answer: A. Bradycardia. Donepezil is an acetylcholinesterase inhibitor commonly used in the treatment of Alzheimer's disease. It works by increasing acetylcholine levels in the brain to improve cognitive function. However, it can also have parasympathomimetic effects, which can lead to bradycardia, slow heart rate, as a side effect.